15 years ago they had photographed it and said that you're done, you know, this is it, it's bone and bone, there is nothing else that we can do operatively. And it was really pushed then to say, you know, there's not much left there, we're going to need to replace the knee. I'm Jerry Turba, professional photographer, semi-retired now, but 59 years old. The knee replacement procedure I actually had on March 31st, 2011. I am sure glad I did get it done. In the surgery, there was severe arthritis, bone spurs that were actually digging into the patella tendon and was probably only months, days away from actually tearing a patella tendon or rupturing it at the very least. And my outcome would have been totally different. I would have probably been looking at learning how to walk again. I really enjoy seeing my provider because he had a great personality, great attitude, and I think he was really genuinely concerned about my quality of life. I mean, he saw the professional part in me too, and knowing what I was doing, and how hard that is on joints. In my hobbies and things that I do outside of professional photography, we're also a landlord, so we've done some building renovations, but that also prompted me to end up building our own house. So it's whether it's some bricklaying or carpentry, building. These are all hobbies that I need to keep a good set of legs underneath me. The recovery, actually, I thought went very well. I was going 3 times a week, and after every one of those, to have more mobility, because they really did work your knee. And yeah, there's some times of discomfort maybe, but it really was, I thought, minimal to that. And as I would leave therapy some Mondays, there would be the next joint camp that people were scheduled to be operated on in another few days or months or whatever coming through for the camp. And I would stop and talk to them and encourage them, because basically I say, look at me, I'm only 2 weeks after operation here. I'm walking with no crutches, no cane. Coming from therapy, therapy is not that bad, and it actually feels good. And I would be good for that entire day after that because of the amount of work that they did with my knee. I just gotta say that what I experienced was absolutely excellent. With my grandson, I like to walk around a lot through the woods, or got some heavy equipment, farm equipment out here, tractors, stuff like that. He likes playing in those. We'll play on rock piles or whatever it is, and he's a very active little boy, and I like doing those active things with him, so I can climb and do all these things with him now. This has allowed me to keep my joints in motion. I've always kept them going, but it has now enabled me to continue into the future to be able to keep going.